Good morning, everyone. We are thrilled to have everyone in our social following come through with us today for this next edition of Mental Health Matters. Mental Health Matters is a virtual chat about issues and topics impacting the behavioral health of the communities we live and love. And today we are thrilled to come through to you with I think this is the third or fourth in our series of Mental Health Matters chat sessions. Today is very special for us because, again, these chat sessions are something that is entirely devoted to discussing issues of behavioral health, and they are hosted by MAO Behavioral Health. For those less familiar, MAO Behavioral Health is the Department of Medical Advocacy and Outreach, known by many as simply MAO. And in 2022, MAO is celebrating its 35th anniversary of serving the communities of South Alabama, particularly rural communities, as a nonprofit healthcare and health education organization. Our organization has evolved over the years to truly grow from what started as a demonstrated need for information, care, and compassion during the HIV/AIDS crisis of the 80s. And today, from being a specialized provider, we have grown in the services and care that we deliver as an agency, which also includes issues related to behavioral health, mental health counseling and support, and looking to do anything we can that helps to reinforce the health and well-being of the entire person. So we're thrilled to have you join us today for this session. September is Suicide Prevention Awareness Month, and I think it's a topic that we can never discuss enough about. And today is entirely dedicated to the issues, getting to know it, discussing what we know about its impact, and looking at ways that we can all play roles to improve the state of health, both mind and body, for those who may find themselves battling or confronting feelings entirely devoted to jeopardizing their own life. So I wanted to welcome you all again. Thank you for joining me. My name is Thomas Stevens. I am the Manager of Communications and Marketing for Medical Advocacy and Outreach. Today, I will be joined by three professional panelists. The first being Rose Blakey Phillips. Rose is a licensed professional counselor. She is recently retired from MAO as a behavioral health therapist, but she by no means is fully retired, as I'm sure she could elaborate, as the passion and dedication of a therapist exceed beyond one role and one commitment. It truly is dedicated to the improvement of the individual. She is also the founder of Wiregrass Suicide Prevention Services. And for those who are less familiar with that, I would allow Rose to elaborate more herself. But it is an opportunity for us, again, to engage all those impacted, both those who are addressing it directly for themselves or for the loved ones who may have lost someone to suicide. We're also joined today by Dr. Erica Butler. Dr. Butler is an education specialist, too, in prevention and support services for the Alabama Department of Education. One of the things that we will dive into today is not only how suicide impacts the general population, but also looking at the topic as it relates to the young people that are so near and dear, and what we can do to preserve their future. We're also joined by Megan Huffman. Megan is the Suicide Prevention Coordinator for the Division of Mental Health and Substance Abuse at the Alabama Department of Mental Health. So I do want to add everyone to the screen so that you can see their smiling, beautiful faces. I believe Dr. Butler may be joining us in transport. There she is. Thank you all so much for joining us today, and I know how difficult it is to set aside time in the middle of a work week when you're not only addressing this issue, but a multitude of other issues, just to try to do your part to advance the communities that are here in Alabama. And I know all of us have that side passion that we can inspire that to transcend Alabama and improve lives everywhere. So I do want to again welcome you. The agenda for today will start with a brief introduction by each of you. I'll allow each of you to kind of just elaborate a couple points about yourselves. Of course, I don't know you all personally. Rose and I have worked together for quite some time. But I think it is important that we all understand the perspective and the unique views that each of you can bring to the subject matter today. Once we go beyond that, we will give each of you an opportunity to kind of focus in a little bit as it relates to your field and your background, before we kind of wrap everything up with some exploration and discussion about resources in the community, opportunities that we know of for people to get engaged in trainings, and then just some general Q&A. So I would say, because I know her first, no disrespect to everybody, I will allow Rose to take the stage first. Rose?
Okay, thank you, Thomas. Well, what I will say is that I became very interested and involved in suicide prevention work as a licensed counselor after the death of my husband in 1996, who died by suicide. So I have lived experience, and I'm so excited to talk about getting to zero, because nobody was talking about suicide in 1996 at all. There wasn't such a thing as Suicide Prevention Month, and we have come a very long way. So I'm excited to be here with you all today.
Thank you. Thank you so much. Let's see. Megan.
Hello, everyone. Again, my name is Megan Huffman, and I'm the Suicide Prevention Coordinator with the Alabama Department of Mental Health. And so my role, as far as with the state government, is to coordinate suicide prevention efforts throughout the state and collaborate those efforts with our community partners.
And I have no doubt that you two probably have worked together. Dr. Butler?
One.
You may have frozen, I think. Can you still hear us? Okay. We may have temporarily lost Dr. Butler. I know that she is.
Can you hear me?
We can hear you now. Can you hear us?
Yes, I can.
Okay, so if you could just kind of, we're wrapping up our kind of introductions. If you would like to just share a few tidbits about you and your role and what you'd like to bring today.
Okay. One of my main responsibilities with school safety is crisis management. So the districts are communicating with me daily and weekly regarding issues of students who are having mental health issues or suicide ideations, self-harming behaviors. So we provide resources and training to the districts to help them with those issues.
Thank you. I think, I think each of you, just in that brief introduction, I think it kind of reinforces why you all can bring a very unique perspective to what is an issue that is impacting everyone. I think, and particularly because not everyone realizes directly that it is impacting them, but it is. And I think, to get us started in terms of a direction, we're going to begin with Rose. Rose, you wanted to kind of help to kind of give us more of an insight into what is now a national effort called
Right.
Getting to Zero.
Right.
So I'm going to kind of turn the screen over to Rose for a minute and allow her to kind of, bring us up to speed.
Thank you, Thomas, and thank you all for participating in this program today. I'm excited to be here. We have come such a long way. As I said, my husband died in 1996, and at that time, nobody was talking about suicide. There were no programs and that sort of thing, and actually, it had just been identified as a national public health problem at that time. And the national strategy for suicide prevention wasn't even created until around 2000. And so, can you imagine having had the opportunity to evolve and to watch this work evolve to the point that we have all these resources today and everybody's talking about it. So we have the opportunity to learn the warning signs and to help to prevent suicide. Today, we have come so far that the CDC reports that suicide is the absolute number one most preventable public health problem in the country. And that has prompted the Getting to Zero Suicide National Initiative. So, Getting to Zero is a national initiative that just teaches us a strategy to help in the prevention of suicide. And the other panelists have such an important role to play, but we, as just the general public, we can help in the prevention of this public health problem. So it starts with number one, taking it seriously. You know, it's no wonder that our suicide numbers have continued to increase through the decades because that old myth, there's an old myth that used to say, and still many people still believe this, if somebody's talking about it or threatening it, they won't go through with it, when in fact it is the exact opposite, which if somebody is talking about suicide or threatening it, that's the number one predictor of suicide. So we want to, number one, take it seriously. Number two, remove the means. If we feel like that a family member may be experiencing depression or whatever, get the guns, lock up the guns, and protect the key. Dispose of, or do something with extra medications, remove sharps and even materials that can be used in hanging. And but remove the means, take it seriously, remove the means, and become comfortable with asking. There's a program called Ask. Ask, are you having thoughts of killing yourself, or are you having thoughts of suicide? I've had so many people, if I ask that question a whole lot, and some people will look at me and like I am just crazy, and they will say, no, I would never do anything to hurt myself. I love myself too much. And other people say, well, I have been having some bad thoughts. Most recently, I had a dear friend who was suffering with COVID, and it just went on and on. I mean, her symptoms just persisted for a long time. And she called me and she said, Rose, I've been having some thoughts that I never thought I would have. And we began to talk through that and get her the help that she needed, some an antidepressant medication, and so on and so forth. But though, it's just real important that we pay attention, we ask, and then it is so important that each of us learn the warning signs and the risk factors of suicide. We learn that about heart attacks, strokes, everything else, what to look for. But it's so important. That is such an important piece, to learn those risk factors and to learn the warning signs, and so that we can, when we see that in our loved ones, in our friends, in our families, we can begin to help them to get additional help. So I've had a lot of people after a suicide has happened. I've had so many people to tell me, if we had known the warning signs, we would have known that that person was very likely to kill themselves. And that is so true in the case of my husband. He had so many of the warning signs and so many of the risk factors. And yet our treatment plan was just to pray that he had threatened suicide. And so our treatment plan was just to pray that that never happened. But today we know that there are other things that we can do. And once we ask someone and they acknowledge that they might be thinking about it, then we need to help them find safe people, maybe a therapist, maybe family members, but work with them collaboratively to create a safety plan, utilizing positive things in their life to help them find a way to live and to find meaning and purpose in their life. Sometimes that's the big piece of it, is helping them get back to finding their purpose in realizing that they're not a burden to others, and that they do have meaning, value, and purpose, and that they can go on. And so for me personally, I say that 100% of the time there are other options other than killing ourselves. It is that that person is in pain, and we want to help them find ways to begin to relieve their emotional pain. And there are those ways. And some of our other panelists will talk more about ways that we can be helpful to them. Thank you, Thomas.
Oh, it's our pleasure. Rose, before we shift over to Dr. Butler, just from my understanding about the Getting to Zero initiative, there are they've through the development of the initiative, they've even created steps to encourage employers and agencies
Absolutely.
to own a more of a responsive position on suicide.
Absolutely.
Is that correct?
Yes, and we will cover a lot of that in our September 29th training. And so we would love to have everyone come out and or be with us for that training, because we will be talking about that. And it's about starting at the top and having a buy-in from everybody, from the top to the janitor, from the CEO to the janitor, where they can recognize those warning signs and help our clients, our patients, to find help that they may need. Yes, it is a huge initiative. You're exactly right. And I had a very short period of time to just give the basic synopsis. But I do want to emphasize, Thomas, that if we all just do what I just talked about, take it seriously, learn the warning signs, ask, remove the means, we can and we will begin to prevent suicides just right there. And then if we include our our organizations, our workplaces, and there's a buy-in there, and we all get on board, we are at a place where we know how to begin to prevent suicides now.
Thank you, Rose. I think, it actually, from that framework, when we look at all of the interconnectedness, I mean, using agency kind of as that launch platform. It actually kind of, in some ways, gives us a segue into Dr. Butler. Our behavior health director was particularly interested, as part of this discussion, that Dr. Butler could really bring our look more into that youth and adolescent focus. And I think there, it probably goes without me overbeating it, that we all have a role to play in making that work. So I'm going to turn this over and allow Dr. Butler to elaborate more.
Okay, so what we are doing from the state level, we help to prepare our school personnel. They are required to take suicide prevention training during their either in-service or any faculty meetings before October 1. And with that training, they also get bullying prevention. We talk about suicide prevention. Like I said, all school personnel are required to get that training. In addition, the counselors are required to do a comprehensive curriculum with kids that are appropriate for their grades. And so right off, they know what signs and symptoms to look for, the school personnel does, and they provide those different resources to the students as well as their families if there are any mental health or psychological needs. So they get that information at the beginning of the school year or soon after the school year has started. So once a student goes to a teacher or a coach or a counselor and they tell them that, hey, you know, I'm thinking about hurting myself, or I'm having these thoughts and I don't know what to do about it, or I'm feeling sad, or I'm feeling anxious, you know, a little depressed. At that time, all school districts have what's called a mental health service coordinator, and that individual will coordinate services for the students. And they will do an assessment, uh, a mental health assessment of that student to see, you know, is this really a threat that we need to get more people involved in, or if we just need to contact the parents and have them to take their child to see a mental health professional or a MD. So after doing that assessment, they will call the parent and inform them of the issues that the child is having. The parent is required to come and pick up their child, and before they can bring them back, they are asked and is to see that mental health professional or an MD and get a clearance letter, which is basically going to state that Jane Doe has been seen in our office, and they will have a date, and that must be on letterhead. So when the parents bring the child back to school for that readmit meeting with school personnel, which will probably consist of a counselor supervisor, the counselor, the mental health service mental health service coordinator, in addition to the building administrator or the principal. They will have a meeting and they will go over a safety plan with that child and their parents. So in the event anything else comes up in the next couple of weeks or months, they have something in plan as far as guidance to help this individual. Now, one thing that we have ran into parents complaining about is taking their child to see that MD or the mental health professional who's going to pay for those services. So all Alabama school districts now have knowledge about building a partnership with mental health agencies within their counties. We have several who have partnered with those mental health agencies, and they have someone on site to see those kids in the event that they're having maybe a psychological or mental meltdown or breakdown, and they need someone to talk to immediately. And that has been very beneficial because the parents don't have to get off work to come take their child to be seen by a mental health professional. is worked into the school day itself. So that's one way that we have encouraged the school districts. When the parents say that they're not going to take their child, or they don't have the money, or they're not covered under their insurance to take them to be seen by a mental health professional, they do have the option for their child to be seen there at school. So let me back up as far as the protocol. When the child comes to the counselor or teacher and they disclose information of what's going on with them, then in that sit down with that child, they are not counseling them. They are gathering information as an assessment piece to determine next steps of what should be done with that child. Because some parents do not want for their children to be counseled by the school counselor. So therefore, they get those next steps of what should be done, and they provide that information to the parents or the guardians of that child. So I just wanted to clarify that they are not providing counseling there in the school. The mental health service coordinator and the school counselors are not doing that. However, many of the school districts are partnered with a mental health agency in their county, and that's who provide the counseling. But it must be approved by the parents. So the parents have to be alerted anytime the child goes to the counselor or a teacher and disclose anything about how they're feeling or what they're not feeling or what they think. And we also have where some friends can also refer or go and tell, the counselor or the mental health service coordinator, hey, my friend so-and-so is having some issues, and I think they need to talk to someone. And teachers can also refer also. So they do that referral paperwork and they give it to the mental health service coordinator, and that individual will take it from there and coordinate those services for the students.
It's really rewarding for me to hear that there really is such a commitment to an active process. I think that's often, I will openly admit I'm not originally from the state of Alabama. And it took a long time for, the state where I grew up to really kind of get to that lens. But it was really informed by, unfortunately, seeing when it wasn't there and the ramifications. So it really is rewarding to know that there is a process that also includes those observations by different people that are all part of that bubble. And I think, most of the time, a lot of processes don't take that into consideration, that, depending on who you are, or like you said, some parents just don't feel comfortable with their kids being counseled. But, well, that means that somebody else is probably in the position to be observing that there's something happening. So I think this is an opportunity too, because you talked about this, such an expansive view. It's the perfect opportunity for us to transition over to Megan, to allow her to really kind of look at what those state and community initiatives are. Because I think, I'm sure that what's happening within the educational system, and those are having to work in concert in so many different ways. So, hello, Megan.
Hey.
Hey, don't go away, Dr. Butler. I'll pull you back in just a couple minutes because we want to do a bit of a Q&A session. So, again, welcome. Thank you, Megan. You're sitting so wonderfully quiet in the background. But I do want to turn it over to you for a few minutes, because I do think I'm aware of some things, but I'm sure there's some things that I'm not. And I know that our viewers would like to have a better understanding about initiatives that are being done on a more comprehensive state. So again, I'm going to turn it over to you.
So the Alabama Department of Mental Health secured funding from Vibrant Emotional Health to assist crisis centers in planning for the implementation of 988 for mental health crisis and suicidal response. So on July the 16th, our state and country entered a new era of more equitable and accessible crisis services with the adoption of 988, an easy to remember 3-digit dialing, texting, and chatting number for anyone experiencing a mental health, suicidal, or substance use crisis. The new 988 number has replaced Lifeline's current 10-digit number. With this transition to 988, it provides the state with the opportunity to implement a crisis system of care that will link individuals directly to critical services. The Alabama Crisis System of Care has three major components. Someone to call. This is directly calling 988. It includes clinically staffed crisis call centers that provide crisis intervention capabilities such as call, text, and chat. Someone to respond. This includes your mobile crisis teams to reach any person in the service area in his or her home, workplace, or any other community-based location of the individual in a crisis in a timely manner. And somewhere to go. This includes your crisis centers that provide short-term 24-hour observation and stabilization services to all referrals in a home-like non-hospital environment. And of course, with this system in place, the state envisions that it will prevent and decrease suicides and other negative health outcomes, change the community response to behavioral health crises, decrease law enforcement responses to mental health crisis, and reduce jail bookings and hospital emergency room admissions related to mental health crisis.
Well, that you see, we got to. Oh, see, this is good. She's clearly done this before because she had that like boom, 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 boom. But
Thank you.
You're welcome. I think that again, often we don't know enough about what's happening from 1,000 feet to figure out how to really tap into it when we need something on an individual basis. So I think that framework that you're sharing really it serves a kind of a more important function than most of us can kind of stop, take a breath, slow down, and pay attention to. That there are these initiatives, there are these efforts that are underway, and for many of us, the roles that we can play really is to help reinforce people are aware of them, people know how to access them, people know how to get connected. I say that not just from my own personal philosophies, but I'm one of those people. I took my mental health first aid certification training to heart. I went through it twice, once for adults and then one specifically for youth. And I think that's the most critical element, is realizing that almost every single person we know can play a role of just being there,
Yes.
objectively, without judgment, but also knowing that it takes an active role to help connect somebody with someone that can address those issues. And I think in so many cases, it's because we just don't realize these efforts are underway. Right. So it does take all of us to try to help keep reminding, keep putting it out there until we're all empowered with that go-to, that referral effort, that get the people connected to make these services happen. I want to bring Rose in to talk a little bit about how all this kind of translates into the therapy and treatment process, because I think that's also a perfect transition. And we only kind of set aside so many minutes today, so I want to try to keep this whole moving. But Megan, don't go away, because we're going to bring you back in a second, because we want to do some more Q&A.
Okay.
Hello, Rose.
Hi. Thank you.
So if you could kind of take some of what the others have said, plus what you've shared already, and kind of give us that perspective.
Well, I think it once the school system or the crisis center has gotten someone to us as counselors, I think, it's important for us to begin to say, under this Getting to Zero initiative, that we've had some changes in the way we do treatment and therapy. Number one is we start with a good assessment using an assessment tool such as the PHQ-9 or the Beck Depression Inventory. And then the assessment drives the case plan, and we work collaboratively with the suicidal person, trying to create a plan using their strengths and what they can, what they agree with, and that's different from us having the power and control and saying, I'm going to call 911 or you've got to go to the hospital or whatever, but where we work with them to determine what would be a safety plan that they could accept and go along with. Now, having said that, there are those times where we have to call 911, and that is where the assessment tells us it's time to call 911. We don't have time to waste. But sometimes in the past that was kind of our first go-to. That was one of the first things that we did. Or some psychiatrists have even said they wouldn't treat somebody who was actively suicidal or whatever. And so those things have changed, and the assessment drives the plan. We work collaboratively with the client or the patient to develop a plan that they can live with, utilizing their strengths. And we don't use the contract, the suicide contract anymore. I still ask them verbally, can you tell me that, can you agree that you won't do anything to harm yourself until we meet again or whatever? But that contract doesn't hold up in court. It doesn't really serve a purpose, and sometimes could it actually interfere with treatment and therapy because it puts us in that position of power and can increase resentment. So those are some of the main ways that treatment or has changed or is evolving. And once again, help them to focus on self-care, self-esteem, that they do have, each of us has meaning, value, and purpose, and to help find that. Now, sometimes in older people, it's hard for them because they may deal with chronic illness, chronic pain, or they may feel like they are a burden to other people. And so we want to be conscious and aware of those issues in that particular population. Each group has its own issues to be identified and to deal with a little bit differently.
That might be a kind of a good kind of segue part. One of the things we want to just kind of set aside a couple minutes for, which I would invite each of you to kind of feel free to chime in, and that is looking at the types of resources or opportunities that we're aware of, either for empowering professionals who are engaged in these roles, or just empowering the population in general, so that they can be more active instead of reactive. Mm-hmm. So you can feel free to chime in, whichever one of you would like to kind of throw some thoughts out there.
Well, I wanted to mention, as you mentioned, Thomas, about the mental health first aid training. With the state here at the Alabama Department of Mental Health, we do offer that training. We offer adult and youth mental health first aid training, and we actually have a community partner that goes out and conduct those trainings called COSA. It's the Council on Substance Abuse. Sorry.
That's okay. We work with them a lot, so that's
Yes, and also we have we provide QPR training. That's question, persuade, and refer. And we actually have our coalition, which is ASPARC, and also Sound Foundation to go out and conduct those trainings as well. So if you all would like additional training or additional information on that, you can always go and visit our website at www.mh.alabama.gov.
excellent. Thank you so much. And I'm glad that you brought that up, even though, again, I did tout that I'm very proud of that mental health first aid. Just out of curious, and I went through it, but it seems to be presented by different partners at different times. But the suicide prevention gatekeeper training, does the state also offer that? I did it through a national agency, but I know that also is for, for those who wish to take it a little bit into a more targeted path when it comes to suicide. That was really what I took away from that. Whereas the mental health first aider, I think, honestly, if I could find a way, every member of the population would go through mental health first aider. But I think, I just wanted to raise that in case, you did have some information about that.
So far as the question, persuade, and refer training is more tailored, focusing on suicide prevention, whereas mental health first aid is all of the above. It's just the umbrella for just mental health issues all the way around. So again, we do provide those trainings, and you can always go on our website to figure out who's conducting those trainings within the time frame that you would like them to be done.
Last question, which I'm sure is the common question for everyone because it came up in the comments, is there a fee for that if they approach the state agency for that type of training?
Both trainings are free.
Okay, I thought they were, but again, I didn't want to make any assumptions. We all got to do what we got to do.
Right.
Thomas, the gatekeeper training is provided by the American Foundation of Suicide Prevention.
That's where I took it through.
Yeah.
I did not know.
That's their training.
Okay.
Yeah.
And that, like I said, that was very specifically suicide. Dr. Butler?
We also offer it from our Office of Prevention and Support Services. We have individuals that go out and do that youth mental health first aid training. I think the districts are only charged for the workforce.
Okay.
Basically.
I appreciate that. I think one of the things, and for our viewers, they will see we've prepared it in a bit of a written slide that will appear when we wrap up, and our panelists are released to go back to the rest of their busy day. But I think that we all have this discussion, particularly because of the new 988 lifeline number, about those types of resources. And it's something I'm sure each of you have a unique perspective to bring to that. I know there was a time from my conversations with Rose in her work with the Wiregrass area that she played a heavy role in trying to make sure that there was that kind of one place to call when there was nothing in place. So can you just, each of you, talk a little bit about these resources, these hotlines that are available to people? It's like a Jeopardy moment.
Okay, I'll go. Okay. So far as our crisis centers, we do have 4 crisis centers that are located throughout the state that are currently answering the 988 calls. In Region 1, we have Wellstone and Crisis Services of North Alabama in Huntsville. Region 2, we have Crisis Center in Birmingham. And in Region 4, we have Alta Point Health in Mobile. We are fortunate enough to receive a 988 capacity grant, so we are working to expand our capacity as far as our crisis centers so that no part of the state will be left with unanswered calls. So we do hope to add on 2 additional crisis centers in Region 3, which is CareStar in Montgomery, and Region 4, Spectra Care in Dothan.
Okay. Anyone else?
Well, it's just exciting to know that has been developed, and that, our young people, they text or, they use social media or whatever. They don't call as easily or as much. And And I also think that they relate more, or that everyone relates more to someone in their state or more in our local areas. I've had people tell me they weren't going to call the national hotline in New York because they questioned whether that person could really relate, although it was a very good resource. But still, I'm excited to see all of this happening, as you might imagine, because I knew it when there was nothing going on. And now it's exciting to see so much being done to prevent suicide.
I'm glad you brought that up because that was one of the reasons, and I was so glad that Megan went down that route because that was kind of what I was hoping we would get to. I think for many people, there is a certain reluctancy when, even though those hotlines on a national level are very well orchestrated and very well trained, I think often, particularly in rural communities,
Yes.
there is a thing that, those people aren't going to understand me.
Right.
And I think, it is really important for people to understand that the architecture of the 988 number helps to at least get it geographically a little closer.
Right.
And I think a lot of that is in mind, both in terms of not only that kind of, it's the same training, but with a localized cultural understanding that has to be infused, but also the fact that if they're doing a referral service, is being aware of what the closest comparables and alternatives are. Am I correct?
Yes, very important.
Dr. Butler, is there something within the educational system that, go ahead.
Yes. What we did last year, the ALSDE Suicide Prevention Committee, we met and we developed a document that's considered as guidance and protocols for suicide prevention. And in that document, we have a resource section that lists resources in every county in the state of Alabama. So it is probably about 20 pages of resources, so that in the event those school districts, if they wanted to get in touch with someone, either a private agency or just someone in their county, then they have that information. They can share that with parents. And we found that that has been very beneficial for those districts to have that resource list. That's found on our website, and we send it out to all of our school safety coordinators. In an email, we send it out to the counselor supervisors, so they have access to that to share with parents.
I think, that's important to know too. I think that beyond the hotlines, that there are resource lists that are compiled and accessible. I think often, even for those of us engaged in it, we think the hotlines are the only thing, as opposed to that, the resources need to be as complex and as extensive as the issue itself. And
Right.
I think it's important for everyone to know that, that document is available through the Alabama Department of Education website. And I think one of the other things just related to this that is specific to the schools, because we've had so much, particularly inspired because of the pandemic over the last 2 years, is if you were going to suggest, if there was a parent that recognized something, what would you recommend in terms of using their school or their school system as a resource? What would you recommend their first action be?
Contact either the individual who's over student support services for their district, or the safety coordinator, or a counselor supervisor, and let them know that, hey, we need some help. My child is dealing with X, Y, and Z. So that would be the first step, to contact someone at their central office or someone at the individual school, and they know what to do, how to take it from there.
And as simple as that may sound to some, I think I know because, I was one of those fortunate kids in a rural community where my dad was the PTA king. There was absolutely nothing happened. He was probably one of the few people that actually read policies and procedures and everything. But, so many things have changed. And I think, again, it's about stripping back onion layers to get us back to, don't assume that the same observations are being made, or they're just known, that your schools actually can be an active partner in what's happening, because you may be observing something, because of course you're the parent. And in the scheme of classrooms that can average, I know most of us have waged this battle so many times for decades, but basically we know that it's going to average anywhere from 15 to 30. So, whereas educators are trying to be observant, whereas other team members are, it's really approaching issues of this nature where young people are concerned as a collective process, where the parents may be observing it, but knowing still they don't have to respond alone. There are resources out there. I want to thank all three of you. I think this has been a truly informative thing. We are about 5 minutes over the scheduled time. If any of you have to dive out quickly, I understand completely. There are a couple questions. If you can stay with us just for a minute, I would like to raise for the three of you, because I think they're relevant for so many people. The first one, I think, this is something each of you brings a unique perspective to. What strategies would you recommend for parents to teach their children how to get help for a friend if they think their friend may be contemplating suicide?
I would ask the parent to be honest and direct with the child and tell them that it is okay to have this conversation. And if they have a friend who is in distress or who is going through something, if that friend is threatening to harm themselves or threatening to hurt someone else, it would be better to tell someone and get help. So they just need to be honest with their kid and tell them it is okay for us to talk about this. Nothing is off limits. Nothing is off the table. But parents have to be comfortable enough to talk about it themselves. So that's why we are encouraging the school districts, when you have those PTA meetings or, have individual parental meetings, to talk to parents and let them know that the school personnel have mental health awareness training, so they know what to look for and to share those strategies and things and how to talk to them.
Megan, do you have something? Because you were nodding a lot. So
I agree with Dr. Butler. It's all about starting that conversation. And once you start that conversation, it's okay to ask, are you feeling suicidal? What are some of the signs that you're seeing? So I agree 100%.
Rose?
I just agree with the other panelists. They've addressed it very well. But, to really encourage our children to be aware of their friends, that may be experiencing depressive symptoms, and to reach out to them and to help them get help.
This is something, of course, it relates to this because we are using a public medium and we really haven't touched on it. But I'm pretty sure each of you has a unique view to bring of the role social media can play in responding to suicide or suicidality today. I think it might be one of the best places for us to just wrap up today's session with each of you offering that. So if we could, we'll start with Rose, go through to Megan, and then to Dr. Butler, because I do think she may be frozen for the moment, but that'll give her a moment for her camera to catch up.
Well, Thomas, social media can contribute to suicidality, and through the bullying that goes on, and it can be a very bad thing, and it can be a wonderful thing when a person says something on TikTok or whatever that they are having a hard time. Sometimes they can be surrounded by others who are very affirming and encouraging, and may even help them to get help, or on Facebook, we know of times when someone has said that that or really implied that they were going to hurt themselves or whatever, and where their friends rallied around them and got help for them immediately. So it can be a wonderful, a life-saving thing, but it also has that the other side of it, where our kids don't know to just get off or quit listening to bullies say mean things to them. And I have heard of some of the meanest things. I could not imagine, some of the things that I have heard having been said to teens on social media, by other teens.
I think, we each have a very unique perspective. I know in my particular role, because so much of this is kind of ingrained into my existence, I can't help but notice it. But I think, the flip side of that is looking at how we can play a role in using social media
Right.
to get messaging out that is
Uh-huh.
reinforcing. Like you said, it's
Right.
basically how can we encourage people to realize that even if you have the supported circle in life, social media can be a very single dimensional environment, and that we really all need to play a collective role of infusing those reinforcing positive
Right.
efforts within the social media dialogue. I think
Mhm.
that all of us, obviously, from whether it be professional or agency roles, we do that. But again, just kind of finishing this line of thought, Megan, do you want to kind of throw some thoughts into the mix?
Sure. So with the department, we also use social media platforms, but we use it as a form of awareness, making sure the individual knows the warning signs of suicide or mental health or substance use crisis. Really and truly just educating them about 988 and those services that comes with 988 as well. So pretty much using social media as a positive in a positive space rather than a negative.
And I think, it's for those of us, again, this is just a little teaser before you move to Dr. Butler. For those of us who do use social media so much on a professional level, is really, this is the free tidbit I'll give to everybody watching in case they aren't as familiar. The value of a hashtag is underrated, because we all, regardless of age, whether we're looking on social media or even a library, we start with topics of interest, and hashtags are the fastest way that most people can follow people engaged in a similar conversation. So when we're really pushing out these things, making sure that our positive messaging reaches into those people's interest categories, it really is critical that we use those hashtags. We have some of them, the obvious ones. Hashtag 988 Lifeline is the new one, so that every conversation about 988, it's associated with, for those searching based off of topic. Some of the interesting ones that are part of campaign efforts by organizations like the National Alliance for Mental Illness, hashtag Together for MH, Together for Mental Health. That adds a certain amount of camp appeal. But then when you think of their hashtag Not Alone, that one, although inspired from a campaign effort, I know I have found it delightfully show up in conversations that really get at the core, not agency specific or anything else, but anytime someone feels alone, that hashtag is so similar to the other hashtags that it pushes the conversation in there. So I just wanted to throw that out there. So for anyone, regardless of whether it's a person or other, you can make a personal difference on your social media by also thinking about, is there a hashtag that may help my comment be part of a larger conversation? So I just offered that again, just as a freebie. Dr. Butler, do you have some thoughts?
We have not or we don't do anything through social media from the Department of Prevention and Support section. However, the school districts have their autonomy to create their own, and many times they are doing this throughout the school year. They will have the PSAs during their character ed periods, or they will be during homeroom or some type of advisory periods. And especially during the month of October, when they have Red Ribbon Week with drug awareness, they will do several things during that month regarding suicide prevention, bullying prevention, drug abuse prevention. So they really do hone in on using PSA and social media that way from their own districts out to their parents and their kids.
I think this is, the message for me there really does lie in the fact that when, for community members and parents out there, is to realize that those are, positive efforts that our schools and our communities are doing. And to be able to, I won't say, because we don't want to beat somebody over the head with a hammer to get involved in things, but at the same point, I think a little positive encouraging of young people and communities as a whole to get behind those efforts, to get behind those campaigns, because it really is, it's all about people power. Any messaging that's out there, if you could tell one person and that one person tells 6 people, and that is the basis of social media, that one message can go from 1 to 1 to 1 to a million very quickly, with enough people playing a positive role in sharing. I want to thank each of you for being with us today. I think we've had an informative, broad view about the issue and the opportunities and resources to address suicide in the state of Alabama. For those who have questions that we were not able to get to today, there's only so much we could get in this short period of time, but feel free to email them to us at info@maoi.org. That's info@maoi.org. And I will share those with our presenters today and allow them to either provide the response through us or to respond to you directly. Either way, we know that, again, it's about information sharing. All of us are committed to the fact that mental health matters. It matters in everything we do. It's also influenced by everything around us. And during the month of September for suicide prevention, there is a role that we can all play. Can I get an amen from everybody?
Yes, and thank you so much, Thomas.
Thank you so much.
And thank you for having us.
It is our pleasure. We are thrilled that you were able to set aside the time to join us today. Everyone, we do plan on being back with you again several times this fall with different topics. We hope that each time you bring a friend to watch this on Facebook and Twitter. Also, you can watch us reshare through our archival recordings at various points throughout the year. And what you will see as we kind of tune out today is some saving grace information, including some slides about other resources of national efforts, including those offered by SAMHSA for the federal government, the American Foundation for Suicide Prevention, the Trevor Project addressing the preservation of the lives of LGBTQIA children, and the Zero Suicide Initiative that Rose mentioned, and of course the National Alliance on Mental Illness. There are a couple local announcements that Rose was kind enough earlier today to make me aware of. For those who are active, there is a candlelight vigil in Landmark Park in the Wiregrass at 6 p.m. tomorrow night, I believe you said, yes. Rose, so that would be September 9th. At 6 p.m., and that is a recognition of those who have lost someone to suicide. And that is supported by the American Association for Suicide Prevention. Also, Wiregrass Out of the Dark Walk is Sunday, October 9th from 1 to 3 p.m. at the National Peanut Festival grounds. That benefits the American Foundation for Suicide Prevention.
Yes.
And then as it relates to those who have lost someone they love to suicide, Rose actually hosts every Monday night at 6 p.m.
No, once a month.
Every fourth. Whoop. See, this is why I did it while you were still alive. So
every fourth Monday night.
Okay. every fourth Monday night at 6 p.m., a support group for families and friends who have lost someone they love to suicide. You do not have to make an appointment for that. Again, it starts at 6. I think you had mentioned about 5:45. Is that what you had?
Yeah.
And that location is 545 West Main Street, Suite 100 in Dothan. Those are events and announcements that Rose did share with us. But if you were looking for information about other things that might be happening in your locality, feel free to also email me at info@maoi.org, and I will pull the brains of our 3 panelists here as well as others and respond to you. It's a joy to spread information to everyone. Thank you again for joining us, and remember, mental health matters.
Thank you.
Thank you.